Hi, my name's Kimberly Thomas and I work as one of the nurse practice advisors for Gen U on the Geelong southwest side, and I support residents and their carers and families in undertaking the CHAP annual assessment. I work as a nurse for Gen U, a disability service provider, and I work closely with members of the team who support clients, family and support workers to do annual health assessments. This is called the Comprehensive Health Assessment Program, or the CHAP. An annual health assessment, or the CHAP, is a health check that people with an intellectual disability have each year. This health check is important because it looks at all areas of a person's body, head to toe, so health issues won't be missed and they can be picked up as early as possible. It also covers mental health, sexual health, vaccinations and health screening checks. People should have their CHAP even if they feel well, because it also used to create an action plan to keep you well in good health for longer. The CHAP tool also prompts the GP to do some specific checks or tests for people with some types of disability where it is known that they may be at risk of health conditions. After your CHAP is done, a health plan is written with a list of things for you and your supporters to follow up on. This could include things like booking vaccinations, cancer screening testing, a dental check or medication review. One of the benefits of having the yearly health check with ongoing monitoring and supports is to develop a relationship with the clinic and the doctor. The CHAP has two parts. Part 1 is filled out by the person with the lived experience of disability and their supporter before the appointment. It is important that you sit together when completing Part 1 of the CHAP tool, and health questions are communicated in a way that the person understands, and for the person to have the opportunity to express their concerns, fears and beliefs and ask any questions about health issues. Part 1 also asks about your family health history and your health history. So things like if anyone in your family has a history of cancer or heart disease. It might ask about what history you have, for example, things like past vaccinations or operations. It's important to do some monitoring of the person's health prior to filling out Part 1 of the CHAP tool to let the doctor know some of the areas that show how well you are or areas that you might need further help with. Book the appointment with the clinic. Tell them the appointment is for an annual health assessment CHAP tool, so it needs to be a long appointment. Tell reception that it's item number Medicare Benefit Schedule MBS 707. Ask the receptionist to provide you with the electronic CHAPS form via your email address. Before the scheduled appointment with the GP, it would be helpful to make an appointment with the practice nurse at the GP clinic, if they have one, to go through Part 1 of the assessment with them. This may help identify any parts of the CHAP tool on your health you want to discuss further. The sections are grouped together, like breathing system, heart system, and others. Some questions will have yes, no, or unsure, and you tick the box of the best answer. For example, it asks, does a person get short of breath while lying in bed? And if they do experience this, then you would tick the yes box. Some other questions ask for more information. For example, it asks, how does a person communicate pain? To describe this, the person may show the doctor where the pain is in the body, then show how much pain by using a scale. For example, Jerry, who uses non-verbal communication, uses a visual pain scale. This is the tool. Supporters may advise about the person's breathing, body language, facial expressions, consolability, or their vocalization to further describe their understanding of the severity of pain. Whereas Sally communicates verbally and needs things to be explained slowly, using easy words and being given time to think and answer. The CHAP tool asks about family history so they can check as part of the assessment if they might have any of these problems. Things like diabetes and high cholesterol or a cancer history that might indicate the need for extra monitoring. You might need to ask others who are involved in the person's life to help gather information, such as family members, health professionals, or others. It is suggested that Part 1 of the completed CHAP tool and any other documents is sent either electronically or given to the clinic about 1 week before the appointment. This is to give the nurse and the doctor time to read your information, and sometimes they may want to talk to you before the appointment to get a bit more detail. It's good to ring the clinic prior to the appointment time just to check and make sure the practice nurse and or your doctor have your appointment scheduled for an annual health assessment and are on time. At times doctors do run late and you might need to turn up a little bit later or be forced to reschedule. Wear suitable clothing that is loose fitting to the appointment so the nurse or doctor can take your blood pressure and do other health checks. Remember that this appointment is for your annual health assessment only. It is not to fill out other paperwork or review medication. You would need to make an appointment on another day if you needed other things done. In the first part of the appointment, you might spend time with the practice nurse. They will go through your documentation from Part 1 and make sure all the information is correct and clear. They may then start to do some other checks, like take your blood pressure, weigh you, or do a diabetes check. Once they have completed their tasks, you would then see the GP, where they will complete Part 2 of the CHAP tool. Once all the assessments are undertaken, the GP and practice nurse and supporter will discuss what needs to be listed in the action plan and who needs to do what tasks to follow up for either further assessment or preventative health checks. An example could be to monitor blood pressure daily or do diabetes check daily, look at healthy eating and making an appointment with a dietitian. It is important for people with an intellectual disability to have a CHAP tool every year, even if they feel well. Going through the CHAP paperwork before the appointment can help you think about things you might want to chat more about with the nurse and doctor. The appointment, which includes the health check by the nurse and doctor, can find and treat health issues earlier. It's important to do all the things in the follow-up plan, including seeing other health people as needed, as this will help the person stay in good health. The CHAP tool is an important link between you, the carers, your family and the health professionals to make sure that all areas of your health are considered. You may feel well and that's fantastic, but there may be some areas that you might not have considered or the health professionals are able to take a closer look at. They may order some further tests, but just ensures that your health and well-being is a priority.